Hi, Wyatt. Hello. Good morning. My name is Joanna Barreau, and I am the music therapist at Children's Hospital. Hello. Good morning. Good morning to you. Wyatt is 14-month-old who I've been working with for about 9 months. Wyatt today. Let's move your feet. Let's move your feet. He is very energetic and enjoys music. Whenever he hears the guitar, he'll start kicking and dance in his own way to a rhythm of the guitar. We're going to take the chimes out first and play with them.
My name is Ravi Thiagarajan. I am a cardiac ICU doctor at Children's Hospital. I take care of children with heart disease who need ICU level care. I've seen Joanna work with patients that I've taken care of who stayed in the ICU for long periods of time, and she will come work with them to the bedside and sing with them or sing to them.
When working with Wyatt, I work on directions when holding the chimes. Play with this hand. Can we play with this hand now? Let's try. We'd like to play the chimes in the morning. Good job. Chimes are something that is familiar to him, and I worked with my hand going up and the chimes ringing above his head. Wanted to see if he's gonna look at them, and then wanted to see if he's gonna be able to focus and then bring his hand towards them. Way up high and down low. Nice looking and touching. We are playing the chimes. Nice job, Wyatt. How about Wyatt's feet? Can feet play? I've noticed also that after his hands were not moving, his feet were moving. So wanted to see if he's gonna be able to access the chimes by his feet. That was very good. The other foot. Ta 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 ta. Ta 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 ta. If I could sense that he has more movement on that day and he loves dancing to my music, if I see him moving, then I'll be inspired by that and improvise on the spot and play upbeat music so he can move and be encouraged and work on the muscles of his abdominal muscles, on his muscles of his legs.
I think children during music therapy often get out of bed, may stand up or may sit down, may dance, and all of those things are physical activities that are really useful for children in the ICU. It reduces stress levels. It perhaps improves their experience. The ICU is a very stressful environment, and we try to normalize it as much as possible for children. And music therapy is one of the ways we normalize things, and it really makes them happy.
We like to dance to music. If we can, we like to dance to music today. Oh, Wyatt, there is a lot of people there looking how you play. I look at the monitors, which might show heart rate, oxygenation, memorize it. Then later during the session, I keep checking, looking at the heart rate, if it's going over, if it's too low, and make sure that we're staying in a comfortable level. When working with Wyatt, I concentrate on his abilities versus things he can't do. So if I see that day that his right arm is moving more, I will be encouraging it and giving him instruments and placing the instruments in his right hand. 1. When I was offering him an instrument, I wanted him to shake to the rhythm, and I would underline it with my guitar rhythm. I was surprised when I saw him passing it from one hand to the other. That's a skill that I would probably share with OT, saying we can encourage that in the next time. And stop. That was beautiful, Wyatt. When working with a patient whom I know, it's easier to know the baseline. Once I know the baseline, I know where to go. Today, what we saw with Wyatt was that he was enjoying vocalizing more. He was using his voice, looking at me. I was trying to also encourage his vocalization by copying and repeating his vocalizations. Before I go, let's sing another song. Before I say goodbye, let's sing one more. So goodbye to Wyatt, goodbye to you. Goodbye to Wyatt, goodbye.
Children who stay in the ICU for a long period of time actually look forward to Joanna's visits, and it really makes them happy. And I've really watched that happen in the relationship Joanna forms with these children, and I'm sure they take it back with them when they go home after they're done with care in the hospital.
One more song, goodbye to you, goodbye to me, goodbye to both of us. Thank you, goodbye. Music is all done. We can do it together. Music is all done.